I on? Yes? I didn't see my cue. Sorry, it might be the glasses and you're too far away, Luis. It's my fault. Good evening, everyone. Welcome to the Lung Cancer Living Room. I'm Danielle Hicks, for those of you who may not know. I think most of you in the room know who I am, but somebody online who may not know. My role here at the foundation is to oversee patient programs and services. So anything that has to do with patient touch, outreach, education is my area of responsibility, of course, along with our amazing team, not just in programs and services, but events, development, marketing, so on and so forth. So thank you all for being here tonight. Thank you all online for signing in. Tonight we're talking a little bit about cost-related health literacy, understanding insurance options, and treatment-related financial planning. I don't know if anybody knew or has known historically that oncology financial navigators were a thing, or that there was an option or resources out there available to you. I do know that a lot of you that I have spoken with over the years, you've had conversations with either myself or Michelle about maybe some challenges with coverage, co-pays, drug access, so on and so forth. So we have Clara Lambert, who's an expert in this field. She is an oncology financial navigator at the Cowell Family Cancer Center in Michigan. So welcome, Clara. Thank you for being here tonight. And then we also have Wayne Yeung, who those of you in the room know, and those of you who have signed in before may know. He is a regular, he and his wife Rebecca here at the living room. He is a caregiver and is here to talk about some of the challenges that they have had and use sort of his experience to help educate others on how to navigate this process. So welcome, Wayne. You guys might notice that Bonnie is not sitting here next to me tonight. She's feeling a little under the weather. She sends big hugs and kisses to everyone. She just wants to make sure, A, she doesn't get anybody else sick, and B, that she can maybe thwart off it being a bigger thing than it needs to be. So hopefully she's signing in from home with Tony. So if you are, Mom, hello. Go ahead and type into Michelle any questions that you may have, because I know it's something that's near and dear to your heart, too. So we're going to start tonight, as usual, with the around the room. Anybody online who might want to introduce themselves, please do so. Michelle's online chatting with you right now. And please feel free to ask questions throughout. As you guys know, we want this to be very interactive. So it's a really great night for those of you who may have excellent insurance coverage and this isn't a problem for you. It's a great night for you to become educated for those people that you might meet along the way who run into these problems so that you can help them kind of navigate the process. So Dave, just because I made eye contact with you, I'm going to ask you to start your event.
Okay. Am I on? I got a yellow light. You got it. It's good? There we go. Okay. I'm Dave, and I was stage 4 adenocarcinoma diagnosis almost 1 year ago. It was March last year. So I'm coming up on my 1-year anniversary, which I'm looking forward to. Longer than either of my parents had, so that's a plus. Anyway, my testing came back and I was EGFR positive, so I could take Tarceva, which I have been on now for 11 months, and that seems to be working fine. My tumors have shrunk, and I also had mets in the brain, which I had SRS. For 5 days, where they did the stereotactic radiosurgery, where they basically shrunk the tumors, and that has caused a little bit of a side effect that I had shared with you earlier, but back in October I had about a 5-minute seizure where I had lost my ability to speak. And so that was a one-time only. I'm now on an anti-seizure drug along with the Tarceva. And so that's, I was not driving for a little while, but I'm back to driving, so things are good there. And so it's kind of business as usual, just kind of cruising along, waiting for the drug to not work at some point when my cancer mutates. And hopefully, I'm a super responder, so we'll see how that goes.
Hello, how you doing?
Good, how are you?
Not too bad. So my name is Fred Palmer. I was diagnosed with non-small cell lung cancer in October of 2013. Currently on immunotherapy after a lot of circuitous routes through chemotherapy, radiation, and some targeted therapy. And it looks like things are working. And right now I'm just dealing with some of the side effects, which is a rheumatoid arthritic condition, and hopefully we can medicate that and get me back to where the immunotherapy is working again. This won't go on too long. But I am determined to make sure that, we would continue one way or the other with that treatment. And this might be jumping the gun a little bit, but I've had a little bit of experience in dealing with various testing organizations. And I just want to let people know, and I think that this is very important, that there's always alternatives, in terms of what you see as the list price of a test or a treatment. In general, most companies who do testing, for example, will only charge the full boat if you're insured. If you're not, there's a substantial reduction. Sometimes they'll even waive the fee. So I encourage everybody not to put off genomic testing or anything else like that, just for the reason that it looks like it costs a lot of money. You can always work something out. So that would be the one thing I wanted to share with the people who are watching this program tonight and people in this room.
Thanks, Brother.
Hi, my name's Rick Bryson. I was diagnosed in February of 2015 with stage 4 adenocarcinoma. Went through a year of chemo and some surgery and radiation, but all that worked out well because yesterday was the 2-year anniversary that I've been cancer-free. Yes. So happy to keep moving on. I did end up retiring from work, and so I'm filling my days with volunteering mainly. So there is lots to do after, after treatment.
Thanks, Rick, and we'll be hitting you up more now that we know you have all this free time.
My name is Tina, and I've been coming here quite a while, which is really great. I was diagnosed in 2010 with the EGFR, and I was 3B was the stage. And I did do chemo and radiation, and then was put on Tarceva more for a maintenance kind of thing, and I've been on it ever since. And so far, so good. Cancer-free. I like that Ned guy. So, yeah. Thank you.
Thanks.
How long have you been cancer? No evidence of disease?
6 years. 6.5 years, something like that.
After 6 years, you're taking the drug?
Yes, I'm still taking it.
Not like 5 years now?
No. But
So-
my doctor we kind of reevaluate every time I go, and he says, well, what I'm hearing now is we just should stay the course. It's working. Stay
Yeah,
with
there's
it.
some, and Tina, I know you and I have talked about it, and I know we've had conversations that you've had with your doctor about it, and it is sort of that, if it's not broke, don't fix it. But then there is that, has it done its job, and do you maybe not need it anymore? And so there's a lot to be learned in that.
Yes. Yeah, they really don't know if Tarceva was the big answer for me because it could have been the chemo and radiation
Right.
knocked everything out. But
Right.
I'm happy to take Tarceva. But I don't really like paying for it.
Okay, Dave has a question.
I just wanted to ask you, is part of the conversation with your doctor a reduction in the milligrams that you take?
No.
So it's either take it or don't take it?
When I first started taking it, I got the reduction in the milligrams to 100, and that's quite fine.
Okay.
So I'm good with that. But,
Right.
But there was a question about to stop taking it at one point, but he decided not to do that.
Are your side effects pretty mild?
Yes.
So that would be part of the thinking, I guess.
Yes.
Yeah.
So a question there, about side effects before I move on. So when you first started taking it, were the side effects greater than they are now all this time later?
The first doctor I went to said, start taking Tarceva first. And he put me on the 150.
150, yeah.
And that was, the serious rash business. And my skin was so dry, it felt like the Mojave Desert. It just like itched, and it was like hard to live with that.
Yeah.
But so then when I went back on Tarceva after treatment that was my third doctor, then he said, well, we can take it down to 100 milligrams and see if that's better for you. Because we know that the 150s are harsh.
Yeah. Okay. Dave, are you on 150?
I was started at 150, but within a month or two, they put me to 125.
Okay.
So I don't know if it's, maybe if it's, weight-based, as to why they would put you at 100 and me at 125 if they're reducing it. I don't know that they really know.
They don't know.
They don't know,
I
yeah.
think
I think
that's-
ironically, during the studies, whether you were male, female, 200 pounds or 100 pounds, everybody got the same dose. And so when it came out, that's how it was prescribed. And then over time, they were able to kind of realize that even at lower doses, it was still effective. Yeah.
But I can see in my oncologist's discussion that, don't change it if it's working.
Correct. Yeah.
Even though I think as a patient, you're thinking, well, should we bring it down a little if the side effects, if it's working?
Right.
Why wouldn't you bring it down if there's a showing of increase of disease? Then you can always bring it back up
Right.
because you've responded well to it. So.
Right. Thanks, you guys.
Hi, I'm Sally. I was found early and was stage 1A and had my lower right lobe removed and have been NED since with nodules that are being watched. And it's been almost 9 years now. And I do want to add a couple of things since this has to do with caretakers and expenses and stuff. One, talking about the testing. On Facebook, I belong in with a lot of the people that have lung cancer. And people were saying that Foundation One, that their insurances would not pay for it. There were several people that have been fighting with this. So I don't know anything about it. I'm just saying that's something that I found concerning. And this was as opposed to just the regular testing that might be done through your hospital or wherever that would be done. And the other thing is something I just learned, nothing to do with cancer, but it might affect people who need to be hospitalized or go into any kind of a rehab or a skilled nursing kind of facility. If you have not stayed in the hospital as an inpatient for 3 days, it all comes out of your pocket. I just learned this 2 weeks ago. They made me pay a month in advance up front. Most places won't even take a credit card. And then they reimburse you for how many days you're not there. So I don't know if this is true for all insurances or just for Medicare, but it's something that I think everybody needs to be aware of.
It's a Medicare rule.
Okay.
Yep.
That's interesting. Because I'm wondering if, well, we can kind of discuss that when we come around to that. But I'm going to get a million emails if you don't want to share your story about what happened. Now that you brought it up.
Well, I only brought it up for other
teasing.
reasons. Well, this little old lady was telling her dog that we were going to go in the car somewhere, and he got so excited that he started running up and down the stairs, and I tripped over him and went boom down on my back for about 4 stairs. And I'll give an Apple Watch commercial for you. If I did not have on my Apple Watch, I never could have gotten any help. I couldn't get up. All I could do was lay there and scream. So Apple, pay me for my...
Right. But how did you obtain that Apple Watch? It's like the most
How
serendipitous.
did I obtain it? I wonder about
The most
that.
serendipitous story ever about how this all kind of came to be.
It was really weird because I had planned to buy one once. I found out that the newest ones, you didn't need to have your phone in X number of feet. And I thought, well, this is good if I'm walking the dog and something ever happens that I will have this. So I go to our gala, and there at the silent auction is the phone I want. And I thought, well, I'm buying one anyway. I may as well bid on it and possibly be able to give a little bit of a donation above what it costs. And guess who won? So I thank the foundation. I thank Apple. But anyway, it did really make a difference. I might still be laying there screaming if I didn't have the Apple Watch.
Yeah.
I'd probably be dead.
Thanks, Sally.
Hi, I'm Ina, and it's good to be here. I don't get here as often as I'd like, so I'm very happy to be here. I also actually am coming up on an anniversary. Monday will be 3 years from my upper left lobectomy. I had a similar situation to Sally, that I had an early stage that was accidentally found and was able to have it surgically removed. So I've been coming for, I guess, a little bit more than a year and a half, it feels like, anyway, through Sally's persistence, who got me involved, and I really do love the people. And what I wanted to say most was that in the last 2 months, I've had I've already had one person come up to me in a social situation and say, I didn't know you had lung cancer. I saw you at the living room. So they were signed online. And it's such an important thing for us to realize that we sometimes drag ourselves out, but we really are, just by being here and by you hosting this, it really does help people out there. This month, I've had a second person come up to me just last Saturday and tell me the same thing. And these are both they're lung cancer patients. And I was able to refer a friend of mine whose mother was really floundering with treatment and didn't know what to do and how to get anything done. And she couldn't come with me tonight, but, there's been so much outreach and help. So I just want to say what a great organization. And really, we know it here, but we're actually helping a lot of people that maybe are not here. So thank you.
Thank you so much for sharing that, Ina. I know that we talk a lot, and we tell you guys all the time, thank you so much for being willing to share your stories with the cameras and the lights and the live stream and everything. But that right there and that testimonial shows you how many people we're impacting, and that's just, she's just one person, right? So thank you again.
Hi, good evening, everyone. My name is Ranlong Zhou. I was diagnosed lung cancer with squamous cell back in November 2014, stage 3. So I was treated in Stanford Cancer Center with a traditional chemo, followed by the surgery, which is my left lung pneumonectomy. And ever since, I've been just doing the CT every half year. My last check was April last year, so my next check will be coming up in 2 months. So far, so good, and keep the finger crossed. Knock on the wood. It's always great feeling to be here. And that's all. And this is my wife, Yan, the caregiver.
So actually I forgot today is the third Tuesday. So I called for my friend who's back in Boston, diagnosed with lung cancer last October, and then they don't have insurance. So when Kim told me about the financing, I just called this morning and then figured out when I need to come here for my friend, please listen to all the financial related. Thank you, gave me the chance to get more information even for my friend.
That's wonderful. That's wonderful. Thank you. Thank you. Anyone in back before I go to online? You just need to grab a mic. There you go. Fred, go ahead.
I'd like
You have
to
a
follow up on what Sally said about the Foundation One. My experience with Foundation One was when they found out that my insurance wouldn't cover the cost, they just wrote it off. I offered to pay them, and they said we can't take it because it's not in our system. Now, I don't know what the current state is, but I know there is at least one representative from Foundation Medicine in this area, and you can talk to that person and work out something, find out what the policy is. I also had a blood biopsy, and the same thing. Kaiser wouldn't cover it. I'm just letting them handle it. It might cost me $99. That's what they said, would be, instead of the thousands that they would charge an insurance company. So I think that my advice would be just go ahead and get the test done and let the provider and the insurance company worry about it. You could always work something out.
Yeah, and there are, and we'll dig into that a little bit. And there are some diagnostic companies out there that their tests have yet to be FDA approved, and so they're still sort of in that validation place. And they are more than willing. And it's not just Foundation Medicine or Garden Health, who I know you were referring to with the blood-based diagnostics. Others out there as well. So Foundation is now got its Medicare code, and it's all on the up and up. So most insurances will cover the Foundation One test now, not all. But we can definitely have that conversation on how to sort of navigate that process.
However, if you're under an HMO and you're going for a Senior Advantage program, that probably isn't going to be the case. They're going to have to work through your HMO.
Yeah.
So that's another thing that they have to consider. But again, my philosophy is let the insurance company and the provider work it out between themselves. Don't try to get in the middle of it unless you absolutely have to.
Yeah.
So, maybe these people that you're talking about might be jumping the gun or worrying, about something that really is not going to be that massive.
This was a young person.
Okay.
And eventually it did get taken care of through Foundation One, but she was just going through the whole story of what she had to do and how they weren't going to pay for it and she couldn't afford it. And
well, then you let Foundation Medicine worry about how they're going to collect.
well, they finally.
Yeah. You see, that's what you do.
But I'm only mentioning this. I only mentioned it so people would be aware it's not automatically paid for by insurance.
Oh, no, it isn't. But it's always possible to work out some kind of accommodation. I found out. This is my case twice.
Yeah.
So, yeah.
Thanks, you guys. Okay.
Hi, my name is Stephen Koh, and I was diagnosed with stage 4 lung cancer last May, and I was on Tarceva, with EGFR positive also, yeah. So I was on Tarceva since last July, and last week was my third scan, and then I found out that Tarceva is no longer working. So I'm actually this week in the middle of doing this blood biopsies. Hopefully figure out whether I have the T790M and whether I'm eligible for that result. Yeah. So I'm just waiting for all those results to come by, and I want to thank the foundation because I may have a couple of emails and people here are very, very helpful. In fact, I tonight I've scheduled to meet with Kim, who's actually flying in for this meeting, and hopefully we can talk a little bit about the options when Tarceva starts to not work. So that's my story.
Good.
Thank you.
Sure. A couple shout outs for Kim tonight, who's over there in the corner in case anybody doesn't know who Kim is. Kim's over there. No, I think that's, you don't have to, it's optional. Sure.
Hi, everyone. This is now, I believe, my 4th time here. I'm Tien from Genentech. It's good to see all of you. And, for us, it's a priority to understand what unmet needs are out there for you and the challenges that you might have getting on the therapy that you need. So I'm particularly interested in this session and just hearing, how you've handled the insurance challenges and potentially, learning and seeing how we can help in the future.
Yeah, hi everyone. My name is Aditi. I'm also from Genentech, and thank you for allowing us to be here today.
Thanks, you guys. Michelle, anybody online want to say hello or?
So Melissa signed in and she just wants to share. She was diagnosed stage 4 adeno in February of 2017. 3 rounds of chemo, put on Tarceva and Xgeva. In April of 2017, PET and CT shows NED is January.
That's great. That's great. Great news, Melissa. Anyone else?
No, just
No?
a lot of people, a lot of new people.
Oh, good, good, good. Well, welcome, new people. Okay, so thank you all for sharing your stories. Like I said, as we're having this conversation, please chime in, raise your hand, kind of flail it if I don't see it right away, because we do want this conversation to be interactive. I think there are people in the room who have already learned a few things just with the around the rooms and some personal experiences that we've all had. So thank you all for sharing. And with that, I'm going to jump into introducing Miss Clara. And I'm going to start by asking you to sort of share your story and how you got into this space to begin with.
So my story is I was actually a caregiver. My husband was diagnosed with lymphoma when he was 32. And we had 3 pretty young kids. I think the day he had his surgery was my son's first day of kindergarten also. So I went through the experience as a caregiver and had to reach out. There were no financial navigators at that time. And so I had to figure out how to pay for Rituxan, which is a Genentech product, and they're very, very generous. There's copay cards for that, and we were young, so we didn't have to deal with the Medicare regulations, so we were able to get help directly from the company with copay cards. But and just other things, like I remember it was right at the beginning of the school year, and so treatment went through Christmas, and just different foundations and organizations out there, and even my husband's a firefighter, and so just the community rallied around us, our church, all the fire departments in the area. And so I was pretty proud of myself for what I was able to do for our family. And I, in the middle of it all, I had lost my job. And so then I started working at the hospital in registration and insurance. And I was like, wow, I could share what I did for myself with other people. And it took me about 10 years to get into this field, but here I am. So that's my story. My husband's a survivor and no cancer, so his was curable. So
that's great.
Yeah,
that's great. It's interesting that you mentioned he was a firefighter, because I think most of us think, well, if people have city jobs like that, the benefits are
He's a volunteer.
Fantastic.
Yeah, so he worked for the cable company for his real job.
Gotcha.
And then, yeah,
Gotcha.
and then a volunteer firefighter.
Gotcha. So,
I mean, that just stirred memories, because my accompanist, I'm a musician, was a firefighter. He died of lymphoma also, and I think it's an occupational hazard.
Yes.
And I think one aspect of this whole financial question is how successful are you in getting disability? That's a real problem, because he wanted to go out on disability retirement, and they would not acknowledge the fact that his lymphoma was probably the result of his occupation.
Right.
And that's a big problem.
Right. Disability is an interesting one. There are there's about 100 diagnoses on a list that pretty much guarantee you a pretty quick approval for disability. But outside of those diagnoses, everybody gets to go through the same process. I think one of the benefits of having somebody like me help you apply is I can help you gather all of the records and everything you need. I can, when we talk about the different questions, because there's a million questions, about daily living and all that for getting disability, and I can help you answer those questions truthfully, which I think is important, but also, with your medical situation in mind, and then help gather the medical records. Luckily, in my area, we have pretty much one hospital system, so all the medical records are in one place. I know in a larger area like this, you might have medical records at several different facilities, but a good navigator would have contacts at the other facilities and work together, and actually be a navigational team for you if you were going to more than one facility.
Well, one of the problems, of course, is the fact that, government agencies, it's to their advantage to postpone it as long as possible, because, the person is going to die. And, that's just a very blunt way of putting it. But this was the case of my friend.
Okay.
So, I mean, he's no longer with us, but, he did leave a wife and children, too. So I think that, it's not only a matter of being effective, you have to be fast
Yes.
in doing this. You can't let them string you along.
Right. I would agree with
Yeah, and I think this points back to the need for more people in the hospital setting that do what you do, Clara.
Right, because we can help, expedite getting everything together because, it's going to go to the government and it's going to take the same amount of time because they're not going to give it special handling just because it came from me. But if we can make sure that when it goes to them that they have everything that they need, it's going to make your case easier because they're not going to go, oh, I'm missing this, this, and this. So.
I think there's a just in talking with patients over the years, there's this sort of lay understanding. Number one, when you're diagnosed with cancer, you expect that your physician and who you're talking to is going to know everything there is to know in order to treat you properly, which, as we know, is not always the case. And then B, especially if you have insurance, that whatever it is your doctor feels is best for you is going to be covered because you have cancer, and of course that's going to be covered, right? And that's not always the case. So I think there's this, it's kind of this double whammy for a lot of patients when they're diagnosed. A, the diagnosis itself, and then B, not being able to get access. So how do patients, this is going to be sort of a twofold question, how do they get access to you or know that you're there as a resource and available to help them? And then B, once that happens, what does your first initial sit down look like with them? What sort of questions do you need to ask them in order to best understand what their needs might be?
So we have a handful of ways that they can access me, but we try to look for some red flags. So if somebody has Medicare with no supplement or nothing secondary, that's a red flag because they have a 20% coinsurance and there's no cap on it. So we definitely want to talk to those people. And then we also look to people who have high out-of-pockets, high deductibles, different things like that that we think, are going to warrant needing help. We also have a patient notebook full of resources that we give to every patient, and our card and our bio and information about us is in there. So we can either reach out, and we try to be proactive and help as many people as we can before they need us. But then also if somebody does run into a financial situation, then we're in the resource book so they can contact us.
Interesting. So is this something that's actually flagged in like EMR by the clinician or the nurse navigator or something?
Yeah, so the nurse navigators, we have primary nurses that work directly with the doctors, insurance verifiers, our social worker. So pretty much anybody, even the infusion nurses, if somebody says anything about having financial issues, they flag it for us.
Wow.
Wow. So we have a pretty big caseload. Sometimes we can't keep up. It's so busy. But so when I sit down with a patient, they've already gotten the bad news from the doctor. And so we talk about their treatment plan. And I think one of the very important things in that sit down is to talk about their insurance and just make sure that they understand what their coverage is. I've found that insurance has made some major changes just in my lifetime, because it used to be when you had insurance, then everything was covered, and that's really not the fact anymore. There's a lot of patient responsibility, and it's covered. However, you have $1,000 deductible or something like that, and so you're going to have a higher responsibility. So I see Sally has a question.
How common is a financial navigator? Are they at all medical facilities or only certain ones? And how do you access them?
So financial navigation is a pretty new career field. I would say it is about 5 to 10 years old. It is, I think one of my hopes is that it's going to be more common, but not all cancer centers have financial navigators. Most hospitals have financial counselors, and financial counselors usually help people apply for Medicaid, help people apply for the hospital assistance programs, and then As far as the pharmaceutical information, a good financial counselor might dig in and be, proactive and try to help with that. But a lot of times you end up having social workers, nurse navigators. I know of some places that have pharmacy techs in the specialty pharmacy or pharmacy techs that do it. So it's not something you're going to find at every facility.
Yeah, I can say in the amount of time that I've been doing this, I've yet to come across a true financial navigator, someone whose job is dedicated to that. To your point, it's been the nurses that are trying to do that. Sometimes administrative staff trying to reach out and help with insurance coverage. Kim, have you, in your history in this, being a nurse and working in hospitals, is that a common place that you're going to have to grab somebody's mic? Sorry. Or Sally's got one, yeah.
A lot of the hospitals have financial counselors, but they're not oncology specific. A lot of doctors' offices, they're a huge practice, they administer a lot of the chemotherapy. They tend to have more of your financial navigators or financial advocates. They're called different things at different places.
Right. Okay.
But unless the hospital is actually providing the chemo, most of them do not have the financial navigators.
And this is where it becomes a challenge, even from a chemotherapy perspective in the private practice. Who's doing it in there? These private practices are so busy and all this stuff's running through. Who's ensuring that there's coverage for
And you can access chemo at a physician's office, at a hospital outpatient. There are some chemo treatments that have to be given inpatient, and then, freestanding cancer centers. So there's lots of different places that you can access chemo, and then all the payers pay those different places differently. So I think it's important as a navigator or an advocate to really be familiar with the payers and how they pay your type of a facility.
Well, and that's a challenge in and of itself, because if you understand one insurance plan, then you understand one insurance plan.
Correct.
Right? Because they're all so different. And I can tell you, even, and shame on me, I mean, this is what I do, right? I have no idea that if, God forbid, I was diagnosed, what would or would not be covered under my own insurance plan, right? I don't know.
Well, so back to that first sit down then. So I think it's important, I try to study the different insurances, and sometimes if there's a new one, I'm going to learn it right along with my patient. But I think it's important to be prepared for that first visit, understand their insurance coverage, help them understand their insurance coverage and what it's going to pay for and what their patient responsibility is. And then we start talking about the different types of assistance that we might be able to find. One of the first things, I think one of your questions, I'm going to get into it, is about insurance optimization. And that's taking financial navigation just a little bit further, really. Not all financial navigators are going to do this, but if your insurance isn't really the best, then we're going to be doing this again in a year. And so it would be really good so what I try to do is, if there's a way that we can solve a situation at the next open enrollment, then let's go back on, if you're a Medicare patient, let's go back in and put the drug list in and look and find the best plan for you and your situation. And I really think if you're on Medicare, you need to do that every year. Don't just go with the status quo of what you have.
So what does that entail? Just to kind of pause there, going in every year. And I will admit also that I don't really understand Medicare. I know there's Part Ds and there's all kinds
so I'm really talking about the Part D, or if you have an Advantage plan.
Okay.
And you can do this with a financial navigator. You can do this, a lot of the area agencies on aging have somebody trained, but you go to the Medicare.gov website and you put in your Medicare ID information, and it'll pull up your specific situation, and then you can you can also put in your drug list, and it will help you look and find a plan where all your medications are on the formulary. It'll tell you if there's any limitations, like quantity limits, and then you can look at what the premiums are for either the Part D or if you're on an Advantage plan.
And so Medicare works similarly to private insurances where there is open enrollment annually?
Yes, there is an open enrollment annually.
I had no idea.
And that's the other thing. So if you have an employer insurance and let's say there's 3 choices, I think every year it's really good to look at those choices and look at the situation. And I have a checklist that I look at with the patients where you can put down the costs and, look at how much it costs in a premium every month, because you should be looking at that also when you're looking at the cost, because it's part of your overall cost. And then look at how much, your treatment. So you have to have a CT scan every 6 months. And like with my insurance, I know that it's going to cost me $150 every time I have a CT scan.
So since you brought up the CT scan, so in lung cancer in particular, the preferred scanning is every 3 months, right?
Okay.
So, but not all insurances cover every 3 months. So the docs want to do it, and then there's the PET scan versus the CT scan, and who gets to do what. And so we do get these questions from patients on, should I be fighting for a PET versus a CT? Is there anything a patient can do when having conversations with their insurance company, whether it's based on validated data or information that, that their doctors could maybe provide them? Anything?
I think a lot of the physicians follow what's the NCCN guidelines. And so if the scans are on the guidelines, if they're able to get the guidelines for their treatment plan, that should usually help the insurance company. And they have those available either for physicians, but I believe you can also get them as a lay person.
One of the challenges, and I'm going to share a story, and I don't know if she's online tonight, but I'm hoping I see her in Phoenix Peoria, right outside of Phoenix next week when I'm in Arizona for the 5K with the events team. We have a patient out there who, and you're not going to get a kick out of it, but it was very interesting what happened. I believe it was a very common one of the blues, and she needed radiation therapy. And so there's a radiation therapy by which they place what are called fiducial markers inside the tumor itself that kind of gauges where the beam should go. So insurance approved placement of the markers, but then denied the radiation. And so she called here out of her head, let me tell you. And I mean, who could blame her, right?
Right.
Like she had to go through this pretty invasive, minimally invasive, but still procedure,
invasive, yeah.
right? To have these fiducial markers placed, and then the insurance company's like, sorry, now you're gonna have to pay for the actual therapy. And I will tell you, by the end of the workday, that very same day, she had the CEO of this blue company on the phone and told him, what was what, and the very next day had her insurance, cover the therapy. And it's really unfortunate in this day and age that someone has to kind of bring it to that level. And she was very resourceful, obviously, and able to, in order to be able to gain access to this sort of VIP in this place. But that's the reality sometimes of what patients have to do, correct?
Right.
Yeah.
Unfortunately, yeah.
Especially when they don't have the benefit of someone like you. So I didn't mean to interrupt. You can go back to the
So that would be
optimization.
something that our insurance verification team would definitely be fighting for the patient. I mean, really, the patient should be fighting their cancer, and then
Agreed.
there should be a support team around them, helping them fight the other battles.
Yeah, agreed. So we were talking a little bit about insurance optimization. Did we? Yes.
So in this particular case of your the person in Arizona, the doctor prescribed this procedure, and it's not the doctor's responsibility at all to first find out if this is going to be covered. So, in other words, or to at least advise the patient that we're going to do the implant, that's covered, but the actual radiation is not. So
I'm gonna respond to that, and then I'm gonna let Clara respond to that as well. I would like to think that the physician is going to prescribe whatever is best for the patient. That doesn't always necessarily happen. And this is where the conversation and the shared decision-making comes into play that we talk about so much. Sometimes what happens is the patient is prescribed what is covered, right? Instead of what might be best. So it's sort of a damned if you do, damned if you don't type of thing from a physician sort of standpoint. Not being a physician, I'm guessing, but I've heard about it enough to know that that happens a lot. So I don't know necessarily if it's the responsibility of, I don't want to say it's the responsibility of the physician to ensure that the patient's only getting what's covered, because that might not actually be what's best for the patient. Does that make sense?
Yeah, it makes sense, but I would think that
It's a conversation.
that conversation
Should
needs to be, so the doctor would say, here's what I recommend, this is the best treatment. We'll check and see what's covered.
Correct.
And then we can talk about it after that.
Correct.
But once again, as a patient, I'm thinking that this is, in a way, this is the responsibility of my medical team to understand the insurance enough.
I'm gonna let you.
Yeah, so
Okay.
I'll take it
Clara?
from there. So your physician wants to know all of that, but they know everything they can about helping you fight your disease and treating the disease. So I do know that the doctors that are coming through medical school now are definitely learning a little bit about financial navigation, insurance coverage. They feel your pain, because I hear them, but know that in their office they have a team that is fighting those battles. I think it's important as a patient, especially that your friend communicate back to her physician so that they know that battle that she fought, because maybe the next time that'll help another patient and somebody from their office can get the, maybe the special authorization that was needed, or find out information and fight that battle for the next patient. So I think that, and it's very important to communicate with your physician and their staff. Some of the, if you come across a battle like that you have to fight, because they want to know that. They don't want you to have to fight those battles. They have a team, really, that's looking out for that. Like, we have excellent insurance verifiers, and if they were to have found something like that, they would have been finding that CEO themselves so that she didn't have to.
Yeah, I think there's a definite challenge in that. There are, and this is, whether it's in cancer or not, or, some other disease, sometimes insurance is going to cover more, so there's more money in the door for one procedure and not another, and maybe that's the one that's being prescribed instead of the one that's best for you, and that's not necessarily a place you want to be either.
No.
So.
No, the doctors want to be prescribing for you the treatment that's best for you and your situation. And then they have a team that is working behind them to help, deal with these battles.
So are the sort of tricks to navigating it this way in optimizing insurance? Because again, you can't expect patients to understand what that means or what that looks like.
Right.
I mean, the tricks to be sort of uncovered, if you will, come through talking to someone like you.
Yeah.
Or someone on the clinical team that is in charge of that?
So as far as insurance optimization, that would be talking to, a financial navigator. And I think it's important that we're, I'm not going to tell you, oh my goodness, your insurance is awful. But I might say, hey, when open enrollment comes around, I think we need to talk and look at what your options are and see if maybe we can get you some better coverage. But in the meantime, we still have to deal with right now. And so we're always looking for resources, any resources that we can find. The non-small cell lung cancer funds have been pretty dried up lately. So we've been having to go through the pharmaceutical companies and get free medication. That's not always the prime choice either, but it's how we're taking care of our patients. Earlier this month, one of the foundations, the non-small cell lung cancer fund, opened up, and it was open for 90 minutes.
Yeah. This is, and we've talked about that. Oh, go ahead, Rick.
Yeah.
I was going to ask, are you familiar with an organization called One Exchange, which is now called Via Benefits?
No, I am not.
Well, I worked for Lockheed, and I had we had really good insurance, but it was pretty expensive. And when I got on the Medicare, they provided a PPO for the supplemental, which I had to pay for, and it was expensive. And anyway, the long story short is that they came out and said, we've hired this company called One Exchange, which is now called Via Benefits, to handle all our retirees that are on Medicare to get the best supplemental plan that they can to cover their particular situation. And with Tina, with her Tarceva, they went through and found the who would pay the most, like it was up to 30% until you got out of the donut hole.
Right.
And then it actually turns out that after that, Lockheed actually reimbursed the rest of the year, which was pretty amazing. And, we were paying a lot more by paying for the insurance that was actually covering the full Tarceva thing. So it was a good thing that worked out for us, and I just wanted to share that with you.
Yeah, that's good to know.
But I don't know if I think there's quite a few large companies like Lockheed that have been using this kind of a thing for their retired employees because they don't want to deal with that, supplemental.
Right, and
so they just turn it over to these people.
Yeah, it sounds like it's the third-party benefits, administrator.
And unfortunately, I haven't taken advantage of what you said, is to go back every year and ask them to reevaluate.
Yeah, I would recommend it, because...
I'll do it this year, but it seemed to me that it was such a, good thing that what we ended up paying for her Tarceva was like $3,000 a year.
And it's important just to make sure that it's still on the formulary for next year.
Yeah.
So I do want to jump into some of the resources that are out there, but before we jump into that space, is there anything, are insurance companies ever, and I don't know the answer to this. Sometimes I actually ask questions I know the answer to just to get it out there for you guys, but I actually don't know the answer to this. Are insurance companies ever willing to work with patients to either on payment plans or reduce costs for certain things based on their own personal situation or income or anything like that?
The insurance company isn't necessarily going to be doing that, but I do know that more and more insurance companies actually have case managers that work for the insurance company. The idea is that they will help you, navigate your medical situation and get the care that you need. But, excuse me, as far as cost goes, payment plans and that kind of thing, you would need to go to your provider for that.
Okay.
And most providers are very generous. They have different charity plans, payment plans, sometimes depending on income levels, some stepped discounts. Some will help people who have insurance, and some won't, just because they have insurance. But if nothing else, if you can't get financial assistance on your payment after your insurance pays, you can definitely usually get a payment plan. Some of them are right within the hospital facility, and some of them are through something like Care Credit or Care Payment or something like that. That is a company that will navigate those payment plans.
It's just interesting to me that payers are probably one of the last people standing that wouldn't have some sort of a plan in place to go ahead and cover for a patient.
Cover it for the patient, and then you pay the payer.
Well, they would, yes, exactly.
Yeah, I have not seen anything like that.
Interesting. Okay, so now let's go on to some of the, we started talking a little bit about some of these buckets. And you guys have heard us talk about this in here before, some of you, not all of you, these sort of lung buckets. There are groups out there, not just large companies like Lockheed, but nonprofit companies, whether it's PAF or Chronic Disease Fund or others, they are in the business of trying to raise these buckets, that's what I call them, I don't know what they call them, of money for different disease sets to go ahead and provide this type of assistance. But to your point, Clara, most of them, because the lung buckets don't tend to have, they have what seems like a lot of money when you hear about it.
But how much
the
does
need
Tarceva
is so
cost,
high.
or Opdivo, and
Can you talk
all the
a little bit about these groups?
So these groups, they are foundations, and basically, there's a rule out there that the pharmaceutical companies can't directly help patient with government-funded insurance. So that would be the Medicare, the Medicaids, the VA, TRICARE. So these foundations are set up and basically treat everybody the same. So you have to fall within an income guideline and different other steps. And they do it disease specific. So there's probably between 5 and 8 different foundations. There's probably about 5 of the more common and then 3 that we reach out to for less common diseases and that kind of thing. But yeah, the lung cancer buckets have been pretty dried up.
Yeah, I tell patients all the time, and because there are some great organizations out there, but that if you literally haven't applied January 1st, like at the ringing of the bell, to your point, what did you say, 90?
It was 90 minutes. It was about 3 weeks ago, so it wasn't even in, in January.
That's when they started.
It was open.
Yeah.
I got an email that was open by the time I got a hold of my patient that we needed to apply. They'd already closed up.
Yeah, yeah. It's definitely a challenge, and we work with a lot of these groups, and we've had these conversations to try and help alleviate this. But as we all know, especially when it comes to lung cancer, fundraising is not where it needs to be in order to ensure that those sort of buckets stay filled. We already discussed a little bit about when patients should consider changing their insurances. For someone who may not really be paying attention to that, or for someone who's in, let's assume, like even like a Kaiser situation, especially at diagnosis, how do they, if they want to step out of the Kaiser system, how does one do that once they've already been diagnosed?
Yeah, so what I'm understanding when you say the Kaiser system is they need to seek their medical care. They have benefits one way within Kaiser, and then basically out of network if they're outside the Kaiser system.
Basically out of network.
Okay,
yeah.
so it depends on if they're going to be able to get the best treatment they can going through Kaiser. If they want to step out and get a second opinion, that's a little more difficult. I would recommend to them to look and see if there's a special enrollment period. And sometimes if you get married, sometimes there's different things that can get you into a special enrollment period, but for sure, open enrollment every year, every insurance. Whether you're through an employer, through the marketplace, or your Medicare, there's an open enrollment every year. That might be the best time, but see, if you're in a stepped insurance like that, your premium is going to go up if you want to step outside also.
Got it. Fred, do you have any comments on that? I know you've gotten second opinions, and then Wayne, I want you to kind of chime in at this point.
Yes, there's an organization in San Francisco. It's just for Californians, but you can get a free second opinion with a panel of oncologists in various disciplines of the field. I've taken advantage of that, and it's free. But I think it's only available to Californians. But there may be plans, organizations like that in other states that do something similar.
Yeah, that's a good point. Every state has some different things, and to take care of the patients in their state. And I brought some props actually.
Great.
So
yeah, please.
Cancer Care puts this together, and this is from 2017, but it has different assistance, and it's not always like the financial assistance to help with treatments, but it's about the treatments to help with even living expenses and that kind of thing. So this one goes through and it has a state-by-state reference, it has a disease reference, and it's through Cancer Care, which is one of the foundations that has disease-specific funds also.
Yeah, so we work with Cancer Care. That we're part of a large group called LungCan. We're actually hosting our annual meeting for all the groups involved in LungCan here in our offices next week. But for those of you who may not be able to see, it's from Cancer Care, and it's called A Helping Hand, the resource guide for people with cancer. So I think anybody who might be interested in
And
something
you can
like
even,
that.
if you wanted for your
For our
wall out
library.
there, yeah, they'll send you a bunch of them.
Great.
So I believe that anybody can ask for those
Great,
too.
great,
So,
great.
yeah, but it's got some state-by-state resources and then some disease-specific resources.
Great. That's awesome.
Yeah.
I mean, did you grab your mic? Sorry, Raymond.
Is the book on Amazon for sale?
You know, I don't know if it is on Amazon. I was able to get it directly through Cancer Care, so I didn't even look.
I'm willing to bet if you contacted Cancer Care,
Yeah, they'll send you one.
they'll just send you one. Yeah.
And it's free.
Yeah. Yeah.
Yep.
Yeah. So you don't have to pay for it on Amazon.
Yeah, don't pay for it on Amazon. It's free through
Amazon
Cancer
doesn't
Care.
need any more money.
Yeah.
Wayne, do you want to
So,
share
yeah.
a little bit of your story and your experience?
Yeah. Well, my wife was diagnosed with 3B lung cancer late in November 21st. So we were put in a unique situation where we had the month of December to look for new insurance because the year was rolling over. And we were also in the process of looking for additional hospitals for second opinions. And we found several, each hospital has their own different policies. So for example, one hospital wouldn't accept a policy from Covered California or Obamacare. There was one hospital that wasn't going to accept insurance from an individual plan, but only through an employer. And so we were doing all of this insurance shopping with my sister, and this is all through individual insurance. And we're trying to have as much of a contingency plan as possible. Your question earlier about getting out of the system or having that special enrollment, you can get into a special enrollment when you get married, divorce, when you move. But we found that if you're lucky enough, you could always start a new business, a small business. And then as a small business, you could apply for a private a group plan that would.
So you either have to get divorced,
You get
or
divorced,
start a new
find
business.
yourself get married, move out of state, or you could start a small business and get a small business insurance plan. One thing about shopping for, there are different tiers, and what we found out was that at some point your out-of-pocket maximum pretty much evens out. So you might be paying lower monthly premium, but all of the other costs start to add up, and they all pretty much come out about the same every year. The one interesting thing that we found was that for many plans, the prescription medicines do not count toward your out-of-pocket maximum. So that's something to consider, because some of those drugs start to get really expensive, and if they don't contribute to your out-of-pocket maximum, it's going to get more expensive for you on a year-to-year basis.
So this was all after Rebecca was diagnosed. So you're going through this sort of, mental shock and anguish right along with her and the family, trying to, wrap your head around the diagnosis, and now you're trying to have to navigate how to pay for the care. How much time did you have to spend learning all of this?
Well, fortunately, my sister was able to help me. She does the benefits for our small company, but there was a lot of almost a full-time job for us up until she actually got treatment. I think Dave had a question about whether or not the doctor should tell you what's covered and what's not covered. That's really, case to case. Some doctors were really great in saying, hey, this procedure is covered, it may not, then you will have to fall back to another one. We had another doctor who just didn't even know. So, for example, the radiologist, oncologist had prescribed an IMRT treatment for her, and we found out the day that she was going in for her first day of treatment that the insurance denied the coverage. So that was really frustrating, right? Because we were mentally geared up to do something, and they just didn't tell you or didn't give you any kind of heads up.
So you didn't know it till you got to the appointment?
Well, they
Or
called
they
us.
called you before the
Yeah,
appointment?
before the
same
appointment.
day.
On the
Yeah.
same day.
Yeah.
And we spent about 2 weeks trying to get this approval to get this treatment plan approved, which they did. And I heard the story that you mentioned about your friend. And I think a lot of insurance, just their default is to always just to deny the first claim, and then you have to go through the appeal process, which can take some time. And unfortunately, we were in the middle of the holidays, so not a lot of people were there, and so it just dragged on. And our nursing staff was really wonderful, and they literally were on the phone for hours, just on hold to get to somebody. And that's their full-time job, and that's and they treat 20 or 30 different patients a day. So you're not going to be able to get the care that you need from them. So we had to do it ourselves. We had to be on hold for an hour at a time, and we were able to coordinate. When we got somebody on the line, then we conferenced them in, and so we were able to do that when they couldn't.
I can't, every time I hear one of these stories, I get more and more angry because I don't feel like it has to be like this. I feel like, we've got these big letters on the wall, right? And all this hope, and we have all these amazing treatments out there to help patients, to cure patients, to chronically manage patients, to maintain quality of life. All of these things that, in my opinion, are due every human being because it's available. And the fact that people have to beg, borrow, steal, and fight their way towards these treatments makes me absolutely insane. Especially when we look at the decision makers behind sort of what is and isn't covered. It's just, it makes me crazy. So that was just my little quick rant. But it makes me really grateful that there are people like you out there to help navigate this process.
Actually, we have a lawyer friend, her name was Risa Donlan, and she pointed us to an organization, the California Department of Managed Healthcare. They're basically a watchdog agency that monitor all the insurance companies. And they have lawyers and doctors on staff. And we were actually going to have them help, be our advocate to get things streamlined and rolling along. But, on that day, we were actually, our doctor made contact and they got the approval. So we never took advantage of that. But, they have a staff who's just dedicated to getting approvals and, making sure that the insurance.
And every state has that.
Yeah, I'm sure, but
and
it's
they all
even,
have different names.
I'm sure, right?
Yeah.
But we're looking at Medicare, and Sally's example earlier, I don't know where Sally went, but if you're not in the hospital for 3 days and you need this sort of, in-house rehabilitation, they won't cover it. I mean, and she didn't know till she was out of the hospital and there. That's a huge expense.
It is a huge expense, and the only reason I know that is because I worked in the hospital as a financial counselor and insurance verifier, and I worked in hospital patient accounts before I got into oncology. I don't know if I would know that working in an outpatient setting.
So whose responsibility is it to inform the patient of things like this? Anyone's? Or they're just supposed to know?
Well, I think Medicare should. They do send out a big book, Medicare and Me, or whatever that they sent out, Medicare and You. Yeah, that book that comes out, it's probably in there, but in her situation, she wasn't an inpatient, and that's the other thing is I do know that the case managers for inpatients in the hospital, when they're looking for skilled nursing for somebody to, as they're part of their discharge plan, they do know that and they're keeping that in mind. But if somebody just needs to go to skilled nursing without having been an inpatient.
But she was an inpatient.
But not for 3 days.
Right.
And then the other
could they
thing
have
is
kept her for 3 days before they sent her over?
Yeah, no. Because if she didn't need to be an inpatient, then they can't
Unless
keep
she
her.
fell again on the way to the bathroom, I guess, while at the hospital.
Yeah. Unfortunately, they can't keep her longer just so that it'll get paid for. So yeah,
Well,
it's complicated.
And there's a Medicare rule behind genetic testing as well, and how long, after you're diagnosed before they'll approve the coverage for it. And and especially in lung cancer, where most patients are diagnosed late stage, and by the time they're diagnosed, most patients are pretty sick. And now you're making them wait, and then there's a 3-week waiting period for that result to come back. So now the patient's a month out before they're even receiving treatment. Is ridiculous. Sorry, another rant.
Well, no, that's good. I think that another thing that I've found in being a financial navigator is I've had the opportunity to do some lobbying and to get to know healthcare policy. So you need to be a healthcare advocate, not just, I think that as part of being a navigator, I need to be an advocate. So I've done some lobbying at the federal level and at the state level, because the federal level governs Medicare and Medicaid and the government-funded insurances. Then the state level is governing the commercial insurances. So,
I couldn't agree with you more, and I was going to wait till the end of the meeting to mention it. But next month's meeting is all about policy and lobbying, and our friends from the Lung Cancer Alliance are going to come out and talk about that. And it was sort of like a perfect sort of part 2 to what we're talking about here today, because until we change things up here at a federal and state level, this is going to continue to be the case for all patients.
And I think it's important, as a survivor, if you're feeling well enough to definitely share your stories about these kind of things, go and share your stories with your representatives and your senators. Definitely.
We need that.
And they like hearing it because it really helps them when they're making their choices.
And especially here in California, we've got some great representatives who are behind lung
I know
cancer
I've gotten,
in particular.
personal thank you notes from them.
That's
thanking me for sharing stories and talking to them.
That's great. Sally?
I have a question going back to my own problem a few weeks ago, but it would relate to everything going on here. There was nobody like you there. I was on heavy doses of morphine and being asked to make all of these decisions all by myself, and being told that it was all coming out of my pocket, and didn't I have this or that I could transfer money, and I'm laying in a bed in pain. Would someone like you then come in and work with me?
Well, your situation wasn't specifically an oncology situation.
Right.
So most of the financial navigators are in like a chronic disease, so mostly oncology. And then since my infusion center at my cancer center, we also help people who come in for infused treatments for chronic diseases. So we do branch out and help with, basically we'll help anybody that comes into our building that needs help. So in the hospital setting, I don't know that there is anybody like me that's not, I go over to our hospital to help our oncology patients.
I'm curious though, and maybe this is the group, Wayne, that you mentioned, maybe it would be a question for Sally to ask them even after the fact. Is there anything you can do post all of this based on the story about you being on a morphine drip and in pain, and you're kind of forced into making these decisions in an 11th hour type of situation? Do you have a leg to stand on? No pun intended. But after the fall.
Yeah.
Dave?
So Clara, you work for a hospital?
I do. I work for a healthcare system.
Okay, so if I can localize this for a minute.
Sure.
The names that I usually hear for most of us are UCSF, Stanford, Kaiser, and Palo Alto Medical Foundation. I don't know if anyone is outside of one of those 4, but does anyone know if any of those organizations or companies have a position like what Clara does? Well, El Camino would be PAMF.
No, it's not. It's separate.
Who is
They do have some PAMF doctors there, but not all doctors there.
It's a private, independent.
It's not part of Sutter?
No.
Okay.
And I'm almost positive that they do have someone.
And I know that Kaiser does a lot of research about insurance and that kind of thing. I would be surprised if they didn't have a financial navigator. But I am also surprised by some of the places that reach out to me for, setting
Yeah.
up setting up financial navigation within their system. So it's relatively new, and I want every place to have a financial navigator, because I think right now we definitely are in need of it, because there's so many different changes going on with health insurance and health care, and
Do you guys have any sort of oncology financial navigation in a box that you could give to someone and help them drop it in their own centers?
There is some consultants that do specific training. ACCC, the Association of Community Cancer Centers, has a financial advocacy network that I'm a part of.
Mm-hmm.
And that's actually how I came to be here. And we have training. We have an online boot camp. So there is training out there.
So is that for...
it would be for somebody who was working in a healthcare system to learn financial navigation.
Is there any training out there available for patients to learn what steps they need to take?
That's another one of my props. Not really.
Okay.
But I was at Rite Aid one day checking out.
Nice.
And there was a book. And I thought, oh boy, what are they telling my people? Because sometimes I think things are misinformed. And I wrote a note to the author, and I have his permission. But this is called Your Best Healthcare Now by Frank Lally. And he is a special, he's a journalist. And he was diagnosed with cancer. And so he went through a lot of things. And actually, for nonfiction, this was a very smooth reading book. I picked it up, and I just couldn't put it down. I read it cover to cover.
That's great.
And it has... get doctor discounts, save with better health insurance, find affordable prescriptions. So he took this journey and he documented it. And just talking about communicating with your doctors, saving money on your drugs, what to do when your doctor suggests a costly procedure. So if there isn't I think really if, have somebody who works in the system help you, but if you don't have somebody in your system, this book was really, as you can see, I've definitely read it. It was a good book, I think,
That's
for
great.
the layperson, so.
That's great. That's great. Wayne, I think you were going to say something.
Yeah. I think Palo Alto Medical Foundation, each department has their own financial person who could tell you how much things cost and what the insurance would do. For example, although Stanford also has a financial department that could offer assistance if you can't pay. I know that they have I don't want to quote them, but they said they would take 50% off of their bill if you don't have insurance. But if you have insurance that they don't accept, then they're not going to give you any break on that.
Yeah.
So. But you're really going to be at the mercy of your existing plan, and that's tough because you only get change out of that once a year. And so, but the nursing staff are great at telling you what your options are, and they'll go to bat for you.
And don't be afraid to ask.
And
right?
you cannot be afraid to ask.
Yeah, exactly. And I know that I think finances or asking for financial help is always difficult. It's a matter of pride because, you've worked hard and you think you've got savings and you think you can take care of it, but it's better to ask up front.
Mm-hmm.
Keep your savings as long as you can, get the help that you can get. Don't be afraid to talk to your doctor and say, I'm finding that my insurance isn't going to cover this. If your doctor didn't know that, they probably have some people that can get started working on that situation.
And don't settle for lesser care, too.
Right, don't.
Because, I think the doctors have more knowledge than you in in a lot of these cases, and we're kind of, as patients, we don't have as much information, and that kind of puts us in a state of anxiety. And so, we would be thinking, well, should we settle for something that the insurance will pay for? And you don't want to do that. We had a director come down and talk to us, and he said, this is your best plan, and the insurance people will pay for it. It's just a matter of you having to go through those hoops. And they are also in a position to know the state of your health and how much time you have before things go critical. And so as scary as that seems, you should not compromise your care.
Right. Sometimes, though, there are certain steps, like you have to have one treatment before you can go to the next treatment. That is how it is, and so you have to follow the steps.
Yeah. And typically that will follow guidelines, like you said. Yeah.
Right.
Yeah.
Yep,
Where,
it would typically
where a
follow-
drug came in approval and all of that kind of stuff.
Right. If
Yeah.
that drug is approved as a second-line drug, you have to have a first-line drug before you can move on to the second line.
Yeah. So before I move on to some of the resources that diagnostic and pharmaceutical companies provide, I just want to do a check-in with you and Michelle and see if there's any questions online.
There's one question.
Mm-hmm.
So a support person's asking for a family with stage 4. A question arose about the spouse providing health insurance, changing her job while her husband is in care for his cancer. IOW, an insurance change, bad idea.
Well, all right, so it can be a bad idea, but as long as there's no lapse in coverage, there should not be a pre-existing issue with employer-based insurance. However, if there is a lapse in insurance, then there can be issues.
So like if COBRA didn't come into effect or
if
there
they're-
was too long in between
right.
jobs.
So if they're changing jobs and they have to work at their new job for 90 days before they get their next insurance, they need to have COBRA for every one of those 90 days in order
Gotcha.
to make sure that there's no lapse.
That's an important point to make.
I mean, the Affordable Care Act has pretty much gotten rid of the pre-existing condition as far as when you new enroll, but sometimes some of the employer plans can have some grandfathered issues.
Yeah.
So I say play safe and make sure that there's
Yeah.
no lapse in coverage.
Does that also apply to Medicare?
No.
Medicare doesn't have that problem, right?
Mm-mm.
Can you talk a little bit about pharmaceutical companies and some of the programs they have in place for
Yeah,
patients?
so the pharmaceutical companies, for most of the brand name drugs, which are going to be your more expensive drugs, Tarceva and Opdivo and all that, they have, most of them have direct copay assistance, and they can give that to anybody who has a commercial insurance, including the Affordable Care Act insurance, which would come through what some people call Obamacare. So that will help directly with the copays. A lot of them have no income guidelines. Some of them do have income guidelines, but I've found them to be extremely generous. And you can just sign up, get those cards, and that'll reduce your copay down to $0, $10, $25, depending on the particular program. It's if you have a navigator or somebody, if you're getting it through a specialty pharmacy, a lot of the specialty pharmacies have a financial department that will get people signed up for copay cards. You can sign up for them online. And also, if there's a financial navigator, it's my job, to get people signed up for the copays. And if it's a copay card for an infused product, then at my facility, we set everything up and we, as soon as the insurance pays, we bill the copay assistance so that you don't have to do the work.
Can you explain a little bit to the group what a specialty pharmacy is? I think for a lot of us that haven't been.
Okay.
Go ahead.
Well, Tarceva, you have to get that through. You can't just get that at, the Walgreens on the corner. You have to order it through, what we call a specialty pharmacy. So some of those drugs are. Does that make sense? Okay.
So it's not like your doctor orders penicillin or
Right.
some
So
sort of
it's not the antibiotic that you go pick up at the corner drugstore. It's basically a mail order pharmacy for specific drugs.
Okay. Thanks. Does that make sense to everybody? Okay. We still good online, Michelle?
Yeah.
Okay.
And then pharmaceutical companies also have backup for those situations when the lung cancer funds have dried up. And so they also are, again, very generous, and we can apply to get free drug for patients through them.
And most pharmaceutical companies, we have the information if you need it. People like Clara will have the information for who to contact if you need it. But they also have specific people on the other end of these forms you fill out and on the other end of the phone who can help walk you through.
Right. Most of the pharmaceutical companies that I work with, I have like a field reimbursement manager, and I meet with them regularly. You know, the reps, when they come in to see the doctors and the nurses, they come and see my coworker and I as well. So we're part of, I think it's important, you know, as a financial navigator, that I meet with the pharmaceutical reps and the field reimbursement representatives, you know, so that I know they bring me when they have a new drug or a new application for a drug. I find that information out, and that way I can, you know, help my patients as much as I can.
And I think a lot of times, the diagnostic companies have them too. So Fred did mention Foundation Medicine and their Foundation 1 testing. Garden Health has some blood-based molecular testing, Biodesics. So there's a ton of them out there, but most of them also have similar. It might not necessarily be as detailed as the pharmaceutical companies or as rigid, but they also do have plans in place to help patients get access to these diagnostic tests. And I think we talk a lot here about how fast and furiously things are happening in cancer, but lung cancer in particular, and things are moving in such a pace that we can usually help you get access to this type of testing and molecular testing. And I know quite often, and I know when you can talk a little bit about the Foundation 1 and the Garden Health and what your experience has been there, and the fact that you don't know yet whether or not it's going to be covered, right?
You know, actually, we submitted our first bill to Garden in December, and I called them about a couple of weeks ago as to whether or not the insurance was going to cover it, and they still don't know. So it's been almost, 2 months?
Yeah.
And then we submitted a second test 2 weeks ago, and you've graciously offered to help us with that. But their ticket is about $6,800 for the foundation. Not foundation, for Garden.
For Garden. And these are things that when looking at precision medicine, these rebiopsies, whether it's tissue-based or blood-based, that, technically speaking, based on what is happening in the academic centers with these key opinion leaders, is at progression, they like to revisit these tests to see what's changed in the cancer. So a $7,000 bill, each time you need to do that is not doable for a lot of patients. And I've actually talked with patients on the phone who have said they're looking to, for some sort of financial help or assistance, and they're actually refusing treatment. And they're saying, I'm not going to put the rest of my family in financial debt just so that I can be treated for my cancer. And it saddens me such a great deal, because there are so many good drugs out there that even if they can't cure you, they can prolong late-stage disease for years and years and years. It's
with good quality of life.
That's a challenge. Does anybody else have any questions? No. Okay. Go ahead, Dave.
Wayne, are you and Rebecca with PAMP?
Yes.
Okay.
Are there any, stepping sort of outside of cost of actual care, are there any resources, or do you know of anybody, or do you help patients with who might need financial assistance outside of
medical treatments? Yeah, definitely. Because when you're going through cancer, most of the time, you end up not working. If you're, of working age, you end up taking at least one day off every 3 weeks, or, you end up taking time off to go to the doctor, time off for treatment. Your spouse or your caretaker is taking that time off too. And so cancer affects your budget, and no matter what income level you're at. So there are also foundations out there that help with different living expenses. And also healthcare systems. A lot of times if your healthcare system's a nonprofit, there's usually fundraising going on, especially, lung cancer, breast cancer, there's usually funds. So yes, we definitely help.
Where does a patient go to find these resources?
The resources are probably in that book also. There's a lot of things on the internet. If a patient is looking for something, I would type in financial assistance for lung cancer and then just go and see. You're going to find out if you do that, you're going to find a lot of things, and because there are a lot of funds, and they might be regionally specific, they might be disease specific, they might be gender specific, but
I think it's interesting, and we talk about this internally a lot, where we live here in the country, and I don't know what it's like in the part of Michigan that you live in, but we talk about sort of there's this bubble, right? And there's this perception about what the rest of the country, let alone the world, looks like. And we travel all over the country, in particular to some of these lower socioeconomic areas where poverty is abundant. And we did this program over the holidays. Some of you may know. It was called Hope Home for the Holidays. And what we thought we were going to do, and we did it with Boehringer Ingelheim, was go to 20 different sites, patients around the country, and just bring them some hope and some joy for the holidays, right? We were going to sing Christmas carols and decorate trees and just kind of try to help them out in that way. And what we were finding as we were talking to these patients, and they were nominated by physicians that we work with in these communities, that what they needed was help paying for food, right? They were like, thanks for the offer of the tree and putting lights on my house, but if you could help me with Christmas dinner, that would be great, right? And so it really was, I think, an eye-opener for a lot of us, for a lot of folks at BI, to understand, it's not just needing help with access to these drugs that are thousands upon thousands, and ultimately, the longer you on them, that's great, right? But we're talking hundreds of thousands of dollars for people who've been on these therapies for 8-10 years. It's a lot.
And people can budget down their grocery bill and get what they get by, but you still want to have your special celebration and have something special.
Right.
So that's
right. Yeah. Absolutely. Does anyone have any comments? Anything? No?
Mara says great questions.
Huh?
Mara said great questions.
Oh, great. Good. Hi, Mara. Okay. So I'm going to kind of finalize with this, and then any final comments before I move into sort of up next and all that fun housekeeping stuff. But what do you see in the future of this space?
So I see financial navigation is becoming more recognized as a career field. And then as we do, we're really reaching out, doing a lot more training, trying to find technology to support us, create technology to support us. And I think you'll hopefully see things that more grand in that department. But we also, I think one of the big things is we aren't somebody that the hospital can't bill for our services. So we're really working hard on making sure that we have ways to show the healthcare systems, the doctors' offices, our value, so that there can be more of us.
Yeah, it's still a business at the end of the day.
It is. It's
right?
a business at the end of the day. So so we're working on doing what we can to, through technology and everything, to show our value, so that we want to be patient-centered and really take care of the patients, but we have to show our value to the facility that we're working for, so that they'll continue to have us and hire enough of us to support all the patients that we can.
Absolutely. Wayne, do you have any final thoughts or comments or anything you want to add before we finish this part of the night?
Well, just for those who are thrown into the middle of it, just don't let the finances overwhelm you. I think get the best care that the doctors tell you to get, and make sure that you don't settle for less.
That's great. I think one of the things we talk about here all the time is nobody can do it alone, right? So there are all these amazing groups out there that offer different services to fill the multitude of gaps that live in the oncology space, right? And each and every one of us can, if it's not something we can do, we can point you to someone who can. We talked about cancer care, cancer support communities out there, offering some of these services as well.
And even, like I said, my husband was a firefighter, and usually, that's a brotherhood, and they take care of their people. And then our church, reached out and did what they can. If your friends and your neighbors ask you how they can help, don't be afraid. Just, hey, can you make dinner on Thursday nights? I have treatment on Thursdays, and I can't do it. I'm sure you have somebody that would love to do that.
That's great. That's great. Anybody else? Any final thoughts? No? We're good? Okay. Well, thank you both so very much for all of this wonderful information. I think it's a huge night, and I'm grateful for the folks in the room who got to listen and those online, and grateful also for those who will go back and be able to watch and get this much, much, much needed information. And I'm excited to continue to work with you to see how we might be able to work together to help get people like you across the country and in the places that we're working, because I think it's so, so, so important. So thank you both very much. And Wayne, thank you for coming up and sharing your story and some of your successes and your challenges in being able to navigate this. In particular, I think one of the things you said that you touched on is it wasn't just you taking time away from trying to be there for Rebecca in an emotional way, but it's your sister and others that were also spending all this time trying to help navigate the sort of financial and payer aspect of this. So thank you for sharing that. Up next, I already talked about our lung cancer living room next month. So we had a great talk with Lori Fenton, who I think some of you who work with LCA may know. She's the CEO over there. And we decided that earlier in the year was better than later to kind of discuss the policy and the lobbying and what we all can do together, patients and caregivers alike, especially when we're feeling good, to help sort of alleviate some of these problems.
I forgot his name, but he said he was into volunteering. Could do some
lobbying. Oh, Rick. Yes. So Eldridge Proctor from LCA is going to come out, and she spearheads sort of their lobbying and programs over there, and she's going to talk to us about it, along with Francis Pruitt and his. He's a lung cancer patient. He's been to the living room before. Some of you may have met him, and his wife Rosalind, who's a caregiver and an advocate. They do a lot of this here in California as well as up on the Hill in DC. So we're going to have a great conversation around what that looks like, what's happening in legislation right now, and what role we can all play. They are definitely the experts in that space, so I'm excited about that. That's the March 20th living room. And then in April, we will have Dr. Jack West from Swedish up in Seattle come and talk about IO and combination therapies. So that should be an exciting living room too. We're grateful to have him come up. Next weekend, as I already touched on a little bit, out in Arizona, Peoria, just outside Scottsdale, we'll be having our 5K. So anybody who's watching, who's maybe in Arizona, has yet to register for the race, please contact us. And let's get you registered and set up. It's going to be a great day. It's a great time of year to be in Arizona. I was just there last week with a couple other people from ALCF. I was in Tucson, and it rained. I don't think I've ever been to Arizona when it rained. It rained the whole time we were there. It stopped, I think, the afternoon we were leaving. But it promises to be perfect weather and not too hot. So if you're out there in Arizona and want to come join us, please do. And my thank yous. So thank you, obviously, to Penn TV, who I say every month comes out here and they set up all this equipment and they do an amazing job. The guys here in the room and those there in the back. If you're here local, you can always go back and watch this again in case you missed anything on Channel 26. They do play it over and over throughout the month, which is where we have also been. People would be like, "Oh, I saw you on TV. It was like 3 o'clock in the morning. I couldn't sleep." So please go back and watch it if you can. Spread the word to those patients who you may talk to in either in your doctor's offices or in other support groups around the area, let them know. Thank you to the Office Bar and Grill for the pesto again and the garlic bread and the salad. Thank you to staff, Kim Shapoister, who's not here, but I think she was here when everybody came in. She works hard to with Michelle and some of the rest of the team to ensure that there's food here every month and that it's hot and out on the table. So huge thank you to her. Thank you to staff who's here. In fact, I didn't tell her I was going to do it, but I don't think I've introduced the new Katie to the group yet. Katie joined us a few months ago now. Katie Skilski, she's back there doing the thing on the leaning against the pole, probably hating me right now. But Katie joined the events team, and she's heading up our endurance program. So, and if you know, and independent fundraisers. I thought Jen was going to grab a mic, but she just said that, and she's walking out the door. So, endurance and independent fundraiser. So, if you're interested in starting your own fundraiser and/or you know of someone who's interested in running marathons and doing things like Tough Mudders, Katie's the person to talk to. We do have bibs available for several endurance events around the country. So everybody say hi to Katie. Big, huge thank you to those who support this meeting. BMS, Lilly, Celgene, Merck, Novartis, Genentech, Astellas, Tesaro, and the Yahoo Employee Foundation. Without the support from them, we could not bring this to you here in the room, let alone live to whoever might be tuning in, and then worldwide as it does, post live. And I think most of you know this, although the ones of you that participate in this don't ever really have to go back and watch unless it was something particularly important to you. But we also subtitle this meeting in Spanish and Chinese. So our reach is, we've reached about 144 countries and had made over 900,000 impressions in those countries. So there's a huge need for this type of information at this level. So thank you all for participating. Oh, one thing I didn't mention, I think we've talked about it before, but our remote living room. So all of the love that you all share here in this room on a monthly basis, we took on the road last year for the first time. We were supposed to do 4, we wound up doing 6. This year we've committed to 6, so we'll probably wind up doing 8. But we are officially signed up in Memphis, Ohio, Chicago, Colorado, Florida, Philadelphia, and Dallas. So if anybody's watching, if anybody in the room has anybody in those areas that would be interested in participating in our 5Ks and our living rooms in those cities, please, please, please let us know. So with that, a final thank you to the most important people, and that is the patients and caregivers and all of you who come here and share your stories, which, as you all know, are so, so, so important, especially for the new people diagnosed. And I think Dave can attest to that. We met Dave a few weeks after his diagnosis, and we want to get more people involved in this space and who we are and what we're doing to be able to provide those support earlier rather than later in the game. So thank you all for sharing, and we will see you next month. Please come get food if you didn't get any. I still see some wine in the bottles and then dessert on the back table. Did Sally bring dessert? Sally, thank you. Okay, so the final thank you goes to Sally for bringing the dessert, as always. Thank you, Sally. Thanks, everybody.